In some instances, it can be an effective replacement. The surgical intervention, obviously, not all conditions can be cured by physiotherapy alone. Votes help it can certainly do so today. I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis. Can physiotherapy make an impact on suffering from this condition, in particular, mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. The scoliotic spine has one or more curves to either side exceeding 10 degrees. They can resemble a C or an S shape. What makes it also treats is to specific types easier to deal with, however. Structural scoliosis, which results from the developments of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancy, these and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and ground-center even plan, as either being as multidisciplinary network of healthcare professions employed in the treatment of scoliosis. Diagnosis comes, firstly, from a thorough physical examination, for any abnormalities and asymmetry. If scoliosis is suspected, that an X-ray will be taken to confirm what's known as the patient's curve angle or severity of the scoliosis. The physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. Capital I. Believe. God knows. His faceted approach to this is ideally broken down into 4 distinct scoliosis of us will experience pain or even discomfort. Mary do, and for these patients that should have pain relief, assists with compliance and also with corrective or prevention exercises. Physiotherapists have a variety of techniques for achieving this, such as the releasing of time muscles, massage, acupuncture, the use of supportive postural, say nothing, in various electrotherapy modalities such as a second wind, any imbalances through stretching and strengthening exercises. This often still includes taping techniques until strength and flexibility of increased. Physiotherapy here focuses on both sides of the spine as well as adjacent areas like the hip or shoulder, depending on what's impacting spinal alignment. The aim is to restore the range of motion of the spine, length and strength, as well as endurance and core stability. This stage is paramount for allowing ongoing treatments in phase 3 to occur. This is because it's there that the patient requires the strength and flexibility gained in phase 2. In order to resume normal activities, these include sports and recreation. Which is the objective most patients have in mind during the treatment process is where we aim to restore full or function. This is where we as physiotherapists need to tailor rehabilitation to the specific patients, so they can safely achieve that functional goals. This, of course, includes trained athletes who place great stress upon their bodies. So caution must be taken when giving advice. And strong encouragement is needed for keeping to realistic recovery times. Final phases. Doubtedly the most important in terms of full recovery. And this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patients. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. It may be utilized, for example, in a case of an unequal leg length. A podiatrist could address this with a heel rise, she rise, or built-up foot orthotic. What patients expect to achieve and what he's achieved varies greatly. However, those with mild to moderate scoliosis, who have a commitment to maintaining their newfound strength and flexibility, can expect a full recovery, especially if diagnosed and treated early. Of this recovery and prevention, and should never be underestimated. So, the next time you're asked, can physiotherapy help my condition? I'd be inclined to give a firm nod and respond by saying, with your commitments, physiotherapy is invaluable. There's an international plant-based nutrition and healthcare conference, hundreds of medical professionals get together, talk about other using this in the practice of man that didn't exist a few years ago, and it's really exciting. There's new vegan medical clinics opening up where all the folks on staff are using lifestyle medicine approaches, not just to prevent disease, but to stop and reverse it as well. Tell me about the menu plays and both equal nutrition facts. growing but Physicians Committee doing a little week who the main players and was being the chief last few months and last year, was being a memorable moment for you. Also, you know, that people don't know about Scott Still who started this. The PBM has this Planttrition project is plant-based nutrition conference. He's been doing these immersion programs for Whole Foods for a long time. Now he has a book coming out, I'm very excited about that. He's just had transformative experiences, you know, he's just a physician in prayer. This is people. I've been doing this in their own little, you know, hometowns, but she's great to get so many people together. Starting never gave. So there's wonderful resources out. Now documentaries, you know, we got a number of documentaries coming up like The Game Changers and Yourself Alive. And I mean, it's just, this is an exciting time to be in the movement. I think, you know, a lot of it is just there's so much. How many we're going to get there if only cause the healthcare costs are spiraling out of control, right? Climate change and we were just going to be forced to have to take these, you know, safe simple, side effect, free solutions, cheaper safer, more effective than conventional medical approaches because we're talking about the leading killers. Are the leading cause of death. The good news is that the vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors. We the power of tremendous power over our medical destiny longevity. He told passionately about the benefits of plant-based diets. Vicky reversing heart disease. My old books, he was a professor of epidemiology, cool, facet inspector. He said he met Dr. Dean Ornish. Dr. Dean Ornish said, the thing with the Pampas movement is he get the sense. You're either with him or against him. We're gonna talk about that in a minute, but also what he said was there on any large randomized, controlled trials. He said Dr. Dean Ornish show me the large random. There. Any, if we know about this since Prince Against Day, where's the data? The large randomized controlled trial? Look at Me published his first CT randomized, control trial July 1990. In The Lancet, the most prestigious medical journal in the world. There was black and white proven with quantitative and geography that we can reverse heart disease. Open up artist without drugs, without surgery, just a healthy plant-based diet. Are the lifestyle changes there? It was, right. So we've known about it for decades. But that was published in most prestigious medical journals in the world. The Lancet JAMA. Yet, what happened? Nothing. Hundreds of thousands of people continue to die of a reversible preventable disease. He says being a loss down the rabbit hole ignored. I said, wait a second, it's effectively the cure. Number one killer could get lost like that. Is there in the medical literature that can help my patients but just didn't have a corporate budget driving his promotion? I made it my life's mission to find out. That's why I started Nutrition Farts.org and that's why I wrote my new book. How Not to Die. Well, I find very interesting is he safe? Assistant needs to take them, both his message. Whole point of Nutrition Facts was to go around the system. Tell me about the democratization of information and the role that's played and why that's been good for the movement. I guess when I started out ignoring the general public and going straight out to try to train the trainers, effectively going out speaking at all the medical schools in the state, to try to, you know, get the next generation of doctors educated. But then I realized that's a slow way of that we don't have time. People are dying. Now, I don't need, you know, for another 10 years for them to kind of slowly take over the medical system. People are dying. Now we need to take this directly to the people. I'm thankfully, thanks to the internet age, we out now, have this democratization of information. Now, everyone has access. Before, the doctors had a monopoly on information about health. And so big pharma, the food industry, all then do is get to the doctors, the tobacco industry. As long as they can get the AMA on, like writing on the checks for $10 million. And so they came out. Opposed to the Surgeon General's report against smoking, 1964. As long as again, it's always in control of the doctors, they control the health message, no longer. Now people get to the science directly, educate themselves, and we can't wait until society catches up to the science because it's a matter of life and death. USDA. event that mission is to expand markets for agricultural products. But it seems like me coming out of the doctor guidelines. Is that one of the challenges we have in the States? The USDA has an inherent conflict of interest to US Department of Agriculture. Look, the same thing happened here in Great Britain, right? There was the Ministry of Food and Forestry, right? And then the mad cow debacle came and they basically dissolve the department, put, food safety insurance, medical professionals in charge of food safety instead of agriculture professionals. Same conflict, measures exist in the States. U.S. Department of Meat Inspections comment helping to come up with a nutrition guideline. Someone who comes to eat more messaging. The message is clear. Eat more fruits and vegetables. There it is. Right there in black and white, the dietary guidelines. But what about Eagle's messaging? Then there's a conflict. So what do you get instead of eat less meat, eggs, dairy? What do they say? Eat less saturated and trans fatty acids, things like that, biochemical components, right? Because they don't want to mention foods because that's too politically unpalatable. But the mention vegetables, they are mention free. Well, the mention Christmas because it's neat more messing. Everybody's happy. Promote agriculture products and promote health. If they can do it without undermining the problem out of it, be happy to make the American public health issues. Can you just explain a little bit about how corrupt the medical industry is in the US, kind of related to we talked about already? Well, there's a number of barriers for doctors. Say okay, we understand why some of them medical associations are sucking up to industry because they're being sponsored by Big Pharma. For example, an individual doctor speaking at, well, there's a severe nutrition deficiency and doctors in education. We just weren't taught this medical school. So we encourage weight without these powerful tools in our medical toolbox. We just weren't taught how to teach people to take better care of themselves, right? Of course, there's other bears, this lack of time, lack of reimbursement. Doctors aren't to tell people to take better care of themselves. And also, there's much of medical education, both during medical school and postgraduate. Medical education is paid for by the drug industry. I mean, the number one reason people go to their doctor. North America sort of called blood pressure checks, and they keep going to get their blood pressure checked so they can tweak the blood pressure medications. And so that's a blown. Not only to Big Pharma, which sell these chronic disease drugs, is that people take every single day for the rest of their lives because they're not actually treating the cause of their disease, right? Because they're not as changing their diet so you can treat every day for the rest of their life. So it's a boon of Big Pharma, but also that's where the doctor's getting the next BMW from and sending their kids to college. I mean, the most cause the bread and butter of the GPS of the primary care docs is these blood pressure checks, which wouldn't be necessary. They didn't have high blood pressure, the number one killer, respectfully.